Hi, I'm Stephen. My paper was written about the effects of music therapy on verbal communication in individuals with brain injury. Music therapy is a relatively new science. It's a clinical and evidence-based approach to accomplish specific goals of clients through the use of music and a therapeutic relationship with a licensed professional. Its specific use on communication, basically all verbal communication, in people with brain injuries has been under the microscope as of late and has proven to be quite useful for patients. Specific aspect of music therapy is melodic intonation therapy, or MIT. It's for people who have experienced brain trauma. It's most commonly used in patients with expressive aphasia. And what that is a disorder in which damage occurs to the left hemisphere of the brain and results in the loss of language. The purpose of the therapy is to assist the client to reobtain short, functional, and spoken phrases independently. The technique of MIT is to have the patient sing those small words, phrases, or utterances to a specific melody while simultaneously tapping out each syllable with their left hand. Each aspect of the treatment leads to higher rates of fluency through accessing undamaged parts of the brain. The purpose of specifically tapping with their left finger is so that the movements correspond to their right hemisphere and become affiliated with left hemisphere vocal apparatus. Now I will show you the positive effects of MIT through Congresswoman Gabrielle Giffords, who experienced brain damage to her left hemisphere through a failed assassination attempt. And following that, I will imitate a small session of MIT, not to the fullest extent due to how long and extensive and challenging it is. Here's a clip of Gabby Giffords' first interview after her MIT and after her brain injury.
As the weeks go by, we see how much music illuminates the roadmap of language inside the human mind. Remember, right after she was shot, the therapist elicited that first mouthed word with a kind of chant.
I love you.
And here, 1 month after the shooting, an old friend brings in his keyboard. Watch what she does. She supplies the word swell.
Gee, it's great to see you looking swell. She did it.
And her
baby.
left arm punctuates.
Believe it or not, that was only a few weeks after her injury. Here's how she's doing today.
How do you feel?
Pretty good.
Pretty good.
Pretty good.
I can see that your arm, your right hand, you move a lot more.
Yeah.
Now, is it painful? Is it hard? No,
It's difficult.
Just difficult.
Difficult.
Yeah.
Difficult. Strong.
Okay. That's the spirit,
She's got
isn't
very
it?
good posture,
Yes.
much better than me.
You do a lot of therapy every day.
Yeah. How many hours?
2 hours of therapy.
Yeah. Here
Yeah.
at the house.
Yes.
What do you love in your life right now? We know what's hard. There's a lot that's hard. But what do you...
Africa.
Africa.
Oh, we're thinking about going on a trip
Yes.
Yes.
next summer.
Other things you love right now?
Football. Gabby.
No.
Gabby loves the
Awful.
NFL. Loves.
Thanks.
I'll get you to come around.
So me and my camera shy assistant are going to demonstrate how a person suffering from aphasia would learn how to pronounce their name using MIT. Now we're going to integrate his favorite animal, a kitten. Kitten, 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 kitten. So after learning small words, they're able to build their way up to larger words and phrases, which improves their vocabulary quite drastically, and are able to have a conversation back and forth with ease after long exposure to MIT. So melodic intonation therapy has improved the lives of many people and will continue to do so. MIT rocks.